I'm a high-risk labor and delivery nurse. Did you know when you go to your 36-week checkup, your provider will probably pull out a swab and ask to swab somewhere very intimate? By intimate, I mean the vagina, the rectum, and the perineum. So here's what's going on. If you consent to it, the provider would be collecting a sample to test for something called GBS, or Group B strep. Specifically in pregnancy, GBS is a bacteria that is often found in the vagina, the rectum, the perineum. GBS is not a sexually transmitted infection, and if found in healthy adults, it's typically something that is harmless, that doesn't require treatment or create symptoms for the patient. It comes and goes. It's possible to have it in one pregnancy and not the other, and to this day, we still don't definitively know why healthy adults may get it. So the reason we test for it is if you're planning on having a vaginal delivery and you are carrying GBS at the time, this could be an infection risk for the baby. If the baby were to swallow fluid or somehow come in contact with this bacteria during the birth, he is now at a higher risk for developing a serious infection related to this bacteria. If the test were to come back positive at your checkup, the good news is this usually can be treated quite easily. What typically happens is when you go into labor, the team would administer an antibiotic through your IV site. Studies show that administering IV antibiotics to a patient within about 4 hours leading up to the birth of their baby can pretty much mitigate that serious risk of infection for the baby. Oral antibiotics do not have the same effect, which is why that's not the standard practice at this time. Let's say you show up, you're in labor, and things move so quickly you were not able to get 4 hours of antibiotics in time. Never fear. Depending on your specific situation and where you deliver at, the pediatrician may recommend that the baby stay admitted for an extra day. This could be a total of 36 to 48 hours. The staff would just typically do vital signs more frequently, keep a closer eye out for signs of infection during your admission before they send you guys home. Finally, if you do test positive for GBS, but at some point the plan changes to be a scheduled C-section, most facilities will not administer IV antibiotics if we're planning to have a C-section. The reason is if your baby is now going to be born through this incision and not likely going to be coming in contact with your perineum, your vagina, the rectal area where we have picked up that GBS on the test, the risk of baby coming in contact with GBS at that point is so low that there just wouldn't be much benefit to prophylactically treating you with IV antibiotics. This is a brief 2-minute crash course on GBS. There's so much more we can discuss, so go to your provider with any questions or concerns you might have. And for more information on pregnancy, birth, labor, postpartum, give me a follow, check out my page.